Dr. Lindia Willies-Jacobo. I'm the Associate Dean for Admissions at Kaiser Permanente Bernard J Tyson School of Medicine. I'm also a professor of clinical science there, and I'm a pediatrician by training. And it really is a privilege to have the opportunity to connect with all of you. As Sandra mentioned, this was in the making. We were planning on doing an in-person visit. And although, this is not exactly the most optimal way to connect fully, we, though, absolutely appreciate the opportunity to do that. So what I hope to do today is cover a little bit of information about our school. I'll tell you a bit about some of the COVID-19 contingency planning around courses, as well as around the MCAT. And then we will close it out with any questions you have of us. But before I get going, I would like for Augmeted Lanier, one of our amazing admissions counselors, to introduce herself to you.
Good afternoon, everyone. My name is Augmeted Lanier. I am one of the admission counselors for the School of Medicine. We have two. So any questions that you may have, there should be an email address at the end of the presentation. You're more than welcome to email us if you have any questions after this presentation, and we will definitely be able to take care of those answers for you. This has definitely been in the works for a while. Like we said, we wanted to see you in person, but we definitely wanted to make sure we were able to connect with Whittier College, and very excited for finally getting everything together for today.
Absolutely. Great, thank you, Augmeted, and thank you as well, Sandra, to you and all of your colleagues at Whittier for inviting us in, and truly for this opportunity to speak a little bit about our school. So without further ado, we are a school that was in the making for probably about 10 years, finally came to fruition in 2015, 2016, and we are now gearing up to matriculate our very first class, who will all be starting in July of this year, July of 2020. And just of note, we are located in Pasadena, California. I think that's around a 26-mile drive from Whittier. We are a small school. We will be matriculating 48 students into our first class. And I think a couple things to be mindful of in terms of our school. First and foremost, we are training our students in Kaiser Permanente's integrated health system. And sometimes we hear that word integrated health tossed around quite a bit. And just to give you some sense of what that means, we are used to a system where you go to a doctor and you may have a broken leg and you have to get referred to the orthopedic surgeon. They may find that you have something else, and there are all these referrals out to different doctors. In Kaiser Permanente, everything is taken care of under one roof. So if you do go to your primary care doctor for any issue, she or he is able to order any tests that are required without getting any prior permission for doing that. So I just thought I would better define integrated health for you. Likewise, at our school, we are absolutely confident that we will be able to train students to explore any field that they would like. When we got our accreditation back in February of 2019, and we had that big New York Times article, one of the perhaps slightly misleading pieces of the article was that our school was only training doctors to do primary care, namely family medicine, internal medicine, and pediatrics. But in fact, our desire is to ensure that our graduates can pursue any specialty they choose, but also that they are comfortable and skilled in working in diverse care settings across the country. And what I mean by that is our school is not a direct pipeline into Kaiser Permanente's residency programs or becoming a Kaiser Permanente doctor. If that's something you would like to do, we will certainly mentor you up and ensure that you are able to do that. But by no means are students in any way required to stay at Kaiser. So I thought I would spend a little bit of time clarifying that. I had to do my own homework. I spent, prior to going off to Kaiser Permanente, I was at UCSD at the medical school for about 30 years. So my learning curve about Kaiser Permanente was very steep. And, one of the things I was reminded of is that Kaiser Permanente has been around for a long time. We were founded in 1945, Henry J. Kaiser, Sidney Garfield, and we are one of the country's largest not-for-profit integrated healthcare systems, right up there with the Mayo Clinic. We are serving more than 12.2 million members, also known as patients in the Kaiser Permanente system. We do refer to them as members, and we exist across 8 regions in the country. We're in California, Colorado, the Mid-Atlantic states, Hawaii, Oregon, and there are a few others. And we as a group are considered among the highest ranked health plans for quality of care in the United States. So again, our students will be able to leverage all of that when they come to the school. So a little bit about our building. I've already shared that we are located in Pasadena. The photo that you are now seeing is a former mock-up of the building. And what I would like to do is share about 5 minutes of our dean providing a tour through our actual building as it is now completed. And that we will make certain that you have the link to view the remainder of the video on your own. I just wanted to do only about 5 minutes in the interest of time. Is that better? Great.
From the Kaiser Permanente Bernard J Tyson School of Medicine, and I'm here today to give you a tour of our new education building. It's going to be a quick tour, just the highlights, but we really hope you'll be able to visit before too long to see the entire building. This is Pasadena. It's really sunny, so the whole goal was to bring the sun into the building. All glass. It's really meant to bring the outside in. Whatever you very lobby that everyone can feel comfortable in. Over here, we have a large seating area with lots of sofas. And I just mentioned it to point out that throughout the building, we have many areas where you can sit and relax, where you can study. We have individual rooms, we have conference rooms, a wide variety of spaces to accommodate whatever you feel like you'd like that particular day. Over here, we have our coffee bar, and we don't have any coffee yet, but it'll be all set up by the time you arrive. Another place to hang out, get a little breakfast in the morning. Now we're going to go into the flex classroom. This is our largest classroom. It can hold over 100 students and faculty sitting at tables, and we're going to use it for a number of things. One example is our health system science training. You will be in groups of 6 for team-based learning, but the idea is to have all the groups in the same room so you can interact with each other. So we'll be doing that here. We're also going to be doing large testing in this room. We have tables that we will use to follow the national standards for testing. What I want to point out is all the screens in the room. This building is very up to date in terms of technology. And these particular screens, we can be piping in someone in the Anatomy Resource Center who is demonstrating something. If one of you during 4th year is off in Rwanda working on building a clinic, you can join in when your class is meeting. And we can also bring in faculty from around the country who might want to engage on a particular topic. Another thing I want to point out is our furniture. Throughout the building, we tested repeatedly all the furniture we got. We tried over 30 different options for chairs, all of us different sizes, body shapes. We tried them to see what would be the most comfortable and practical for you. And they're just one example of how we've tried to bring in furniture that would be the most effective for you to learn in. That was the flex classroom. Now let's go over to the convening stairs. Now I want to show you our convening stairs. They are a multi-purpose area of the building. When we're having a big speaker and we want to have everyone together here, we can close off the entire area. It becomes a closed auditorium. There is a massive screen that will come down from the ceiling and it becomes a lecture hall auditorium. if there's a level of speaker where everyone in the building wants to participate, we just leave everything open and we bring in chairs all around and we have that many more people able to participate. But during the day, when no one's speaking, we also want these to be useful. Let me point out that the seats go down and you can put your books or food on it next to you. So let me show you another feature of the stairs. When we've got multiple seats down, we can put out these ottomans so that you can sit in a group. You can sit in your group of 6 or your group of 8 and work on the next day's assignment. You can sit with a few friends and just eat lunch. But the idea was for this space to be able to be used all day long. Why don't we go over to the simulation center now? Now we're going to go into the skills center. This is where you're going to learn how to draw blood, intubate, and a number of other skills. You're going to get to practice as much as you want before you're with actual patients so you feel completely comfortable. Now we're going to go into the home health room. This is the home health room. This is where you're going to learn how to work with someone in their home or in a hospice or similar setting. And it's also where you're going to work with nursing students and jointly take care of simulated patients. Now we're going to go on to the rest of the Sim Center.
So I hope that you enjoyed that video, seeing a little bit about our school. So I hope that you enjoyed that video, and I would encourage you to go back to the link once we've sent it to you to get a sense of the remainder of our building. I do think that you will enjoy the rest of the video that was shot by, filmed by our dean. So in terms of our, of living in Pasadena, a couple things that I think we think about when we talk about Pasadena. One is that it is a home of the Rose Bowl and the Rose Parade. I think as a school, it's important as students to recognize that we are also nearby many educational and scientific institutions. Caltech comes to mind. We do have an MD PhD student in partnership with Caltech that you would apply to separately if MD PhD programs are of interest to you. We're also close to the Jet Propulsion Laboratory and many other educational institutions in the state of California, or in the LA area even. We're close to Old Town, lots and lots of shopping and dining and nightlife. Of course, that was in our pre-COVID-19 lives. Who knows how things will evolve over time. We are also close to mountains with hiking trails. We are very, very close to downtown LA, and we are 45 minutes from the beach. And for those of you who are native Californians, click present, we can see all the slides. Who are native Californians, you're probably aware that you can essentially go to the ocean, you can ski, and you can go for a wonderful hike all on the same day. So in terms of our leadership team, a couple things that I would like to point out, but I will first start by reintroducing our dean, Dr. Mark Schuster. He's been with us since October of 2017. He came to us from Harvard Medical School, where he served as the William Berenberg Professor of Pediatrics. He was also the Chief of General Pediatrics and Vice Chair for Health Policy in the Department of Medicine at Boston Children's Hospital. Dean Schuster is quite a visionary. His PhD is actually in the area of health policy, and you can kind of read some of his own contributions in terms of being an international leader on child, adolescent, and family health, issues centered on paid family leave, as well as on sexual minority health and bullying. And this is our leadership team, and I will say on a personal level, it's been an amazing privilege working with these very talented people. But part of why I'm sharing this visual of our leadership team is, I didn't mention earlier, but our school really has a focus on equity, inclusion, and diversity.
And when our dean put together this leadership team, that was really at the forefront of his thinking. I think a couple things you can see from this: there's significant gender diversity, there's also a significant racial ethnic diversity, but I can assure you that there are many aspects of diversity that you are not really able to see simply from a photo. But suffice it to say, we're all coming in to this group from all over the country, from a variety of academic institutions. So again, just bringing all of our minds together, thinking about how to develop curriculum, et cetera, has been quite amazing. In terms of our educational approach, we think of our school, and specifically our school's curriculum, under 3 pillars. So I think the first 2 pillars are definitely areas that you are probably going to see at many other medical schools. And then the third is somewhat distinct to us. So the first pillar is biomedical science, and this is where we teach all of the basic sciences. The second pillar is our clinical science pillar or department, and this encompasses all that happens in the clinical spaces. So everything in the clinics, everything in the hospitals, but also all of the clinical work that you will end up doing at the school itself. And then our third pillar is often thought about as kind of a forgotten pillar in medicine, and it's called health system science. And this is where we think critically
about how human relationships organized in systems influence health. And again, this is the department where you're going to learn a lot about health economics. You're also going to learn a lot about health and health equity. So in terms of our educational approach, we are going to use a small group, case-based team learning approach, which means that we are by and large a non-lecture based school. And so I think any student who is applying to our school, that's going to be extraordinarily important to know. Another distinct feature of our school and of our medical education approach is that we will be teaching anatomy without cadavers, and we will be using augmented and virtual reality to do that. So just a quick word about there not being cadavers. So when we think about anatomy being taught with cadavers, we think about being in an anatomy lab, physically dissecting out cadavers. This is how I learned anatomy, for example, back in 1988. And what we've done for our students is we have ethically pre-dissected cadavers, and you can actually exquisitely see the structures of the body in that way. And we do believe that this creates a wonderful approach for teaching clinically relevant anatomy. Just to give you a little bit of a sense of our augmented and virtual reality, this is a heart. The student is engaging in utilizing a virtual platform. And then not only can the student create a cross-section, but they're also able to do that alongside the imaging. So you'll note that precisely what the student is seeing by way of what are called HoloLenses, that student can also be engaged with another student and see that very cross-section in a CAT scan. So again, incredibly forward-thinking and quite innovative, and it does allow us to teach various aspects of clinically relevant anatomy. We also will be starting our clinical encounters quite early. So by about week 4 or 5, our students will already be going out to the clinical settings in something known as longitudinal integrated clerkships. And what that means is that during your first 2 years with us as a school, you will be going out to one of 6 Kaiser Permanente medical centers in the greater LA area. And to the right on the screen, you will see the 6 clinical sites that we have identified. And one of the main reasons we've identified these specific sites is it really allows our students to engage with a very diverse population throughout the LA area. The way that these longitudinal integrated clerkships work, or LICs as we've termed them, is that in year one, you will be paired with either a family medicine doctor or an internal medicine doctor. And then in your second year, in year two, your encounters will look the way that it will look for other medical schools in their third year, right? So we are front loading our clinical experiences so that in addition to family medicine and internal medicine, you will also be doing OBGYN, pediatric psychiatry, and we've also have you lined up to do some emergency medicine shifts. Another incredibly rewarding and important aspect of our curriculum is service learning. So service is also at the core of everything that we do, as well as community engagement. And what we have done is every student will have not just go out to a federally qualified health center or a community health center on a monthly basis, but a service learning project is one of the requirements of our school. So a couple things to note on this slide. This is just a different view of the 6 longitudinal integrated clerkship sites. And we've also ensured that the federally qualified health centers are at those or in the same area as your LIC. So for example, if you happen to go out to Downey Medical Center for your longitudinal integrated clerkship, you will also then go to the Family Healthcare Centers of Greater Los Angeles, since that's the one in the Downey area. Well-being, coaching, and academic support are, again, an incredibly important aspect of our school and of our curriculum. We are all cognizant that burnout and anxiety, depression certainly are on the rise for many in the healthcare field. I think we're all aware that things are changing rapidly in light of COVID-19, and this level of burnout and anxiety and depression will only continue to worsen. We have decided that from the get-go, we are curricularizing well-being, and I'll kind of show you some of that by way of something known as our REACH curriculum. And before I do that, though, I also wanted, and I think this goes incredibly nicely into the climate that we're now in, with the level of uncertainty that we're all experiencing with COVID-19, is that our school is going to prepare students to be curious, but to also have kind of this understanding of uncertainty and ways to use that in one's ability as well to become a lifelong learner. I think that we are all incredibly curious regarding how this COVID-19 pandemic will play out, and certainly this is some of what we will be helping students through as students enter our spaces in July. I promised to talk with you about our REACH curriculum. REACH stands for Reflection, Education, Assessment, Coaching, and Health and Wellbeing. And there are 5 module learning series. And I'll show you this, I believe, in the next couple slides. We have some actual mock-ups of what the curriculum times will look like. But suffice it to say that every quarter, our students will spend in 1-week blocks over 4 years, they'll spend time with a REACH coach. Every student will have a professional coach, and that coach will emphasize personal and professional development. So in terms of the topic areas covered during those weeks, students will be engaging in well-being practices and learning new ones. They will also be exploring ways to maximize their resilience skills. They will do a lot of self-reflection, a lot of goal setting with their individualized REACH coach. And they will also spend time reflecting on their academic performance and other types of performances throughout the year. And then lastly, and I think perhaps one of the more important features of this course is that students will really begin to define their professional identity as a future physician. So when I went to medical school, when one got to the third year and you got your white coat, you kind of went into the clinical setting, and then you graduated, you know, a few years later. And then someone said you were a doctor. And I think there was a lot less attention being paid to really developing that professional identity. So we at the school have been quite intentional with ensuring that we are doing so. So a couple kind of general mock-ups of our curriculum, and we can certainly ensure that you guys get copies of these as well. And the slides are going to get a little bit busy, and there are a couple items I would like to point out on each of them. So this is a sample of what we call our phase one, or kind of year one weekly schedule. And a couple of areas to highlight. You'll note the 10 colored areas that begin on Monday, Thursday, Fridays at about 1 p.m. And this is really a lot of independent time. Whenever one goes to a non-lecture based setting and a small group team-based learning environment, it is important that we're providing students with an appropriate amount of time to ensure that they have the time to prepare for the next day's lesson. The next thing I wanted to point out is the green block on Thursdays, and one of two things will happen on that day. So for 3 weeks, you will be going every Thursday to that longitudinal integrated clerkship. But once a month, instead of doing that, you will be going out to one of the community health centers for your service learning day. This again just gives us a view of year one, three particular highlights on this slide. When our students join us, we have an early immersive experience before school starts. The second thing I would like to highlight, we talked about the REACH course and where that happens. And going vertically, you'll note that it's on a quarterly basis. And then the third thing I would like to highlight are just the vacation blocks that we have set up for our students. This is getting even busier, and just again, a quick schematic, and there are only a handful of things I would like to point out here. This is year one, year two, year three. We are ensuring that our students have ample time to prep for their board exams, and so that we have built in a 6-week period of time for our students to do their prepping for that particular exam. And then, of course, there's a lot of residency activity as students begin applying to residencies in that we've built in toward the end of the 4th year. And then you can kind of get a better sense of where the REACH weeks fit in, as well as vacation time. I talked a little bit earlier about some of the educational institutions that are close to us, and I did mention Caltech. We do have an MD PhD program with them. And one thing I should mention, and I don't know how many of you will be applying to the 2021 cycle, but for those who are, please remember that you would check the MD PhD box on AMCAS so that we know that that is in fact the program that you are interested in. We do have 3 MD Master's programs. We have a Master's of Health Systems Engineering with Loyola Marymount University, LMU. We have a Master's of Public Health that we're in partnership with UCLA. And we have a Master's of Health Administration with USC. So the way that that would work, unlike the MD PhD, the master's program you would apply to later. So most students will be applying at the beginning of their 3rd year of medical school, and you would leave KP, you would leave our school at the end of 3rd year, go off to the master's for 1 year, and then reintegrate into the school to complete your medical degree. So in essence, these are MD Master, 5-year MD Master's dual degree or joint degree programs. A couple just granular admission stuff, and this is all on our website. The prerequisites are to your left, and the recommended courses are to the right. And I don't think any of this perhaps is all that surprising, but please be certain to look at those prereqs and recommended courses as you are beginning to think about putting your applications together. And then some application requirements. We do have the MCAT as a requirement. I'll speak a little bit toward the end regarding our COVID-19 contingency planning around that. We want you to have taken the MCAT no earlier than July of 2018. We do require that students get their bachelor's degree from an accredited college or university in the States or in Canada. And then international degrees are going to be addressed on a case-by-case basis. We do utilize AMCAS as our primary application service. Our secondary fee is $50, but we certainly can waive that based on need. So if you have a AAMC, if you're part of the AAMC's fee assistance program, then that will be waived. 3 to 6 letters of recommendation. We do take on the letters of rec packets that sometimes will come from your pre-health advisors. And then our interviews, we use a hybrid model, which means that we conduct both MMI and one-on-one interviews. So in terms of our COVID-19 contingency planning, and everything that I'm going to say is something that we've all agreed upon as California admissions deans. So essentially every school in the state of California with a medical school we've decided that we are going to be accepting pass-fail grades without prejudice for any course that's taken during the COVID-19 pandemic. We were getting a lot of questions from students and from pre-health advisors regarding certain courses in the spring semester only being offered pass-fail, or in some cases students were being provided with options to take for grades or pass-fail. And we've just decided if pass-fail is what students are most comfortable with, and if that's the only option, then we're certainly going to accept those. And likewise, we know that at least 8 MCAT dates have been canceled. So far, the AAMC is doing all that they can to rapidly reschedule those courses. We expect that testing will resume prior to October. So for now, what we're saying to students is please feel free to apply to our schools without your MCAT if you've not yet taken an MCAT, but we certainly will require the MCAT prior to making any final admissions decisions. But again, I emphasize we do not want students to delay their applications because they do not yet have a score. A little bit about financial aid. Our tuition and insurance, we have scholarships for every member of our first 5 classes. So that means that anyone who matriculates with us in 2020, 21, 22, 23, or 2024, your tuition and insurance will all be covered by us at the school. And then we also will provide grant aid in order to offset your living expenses, and that will be based on need. So with that, I will now invite you to ask any questions. I will stop sharing and hope I don't make a mess of this, and my apologies for all of the technical difficulties that we experienced today. But thank you all for attending, and I will now entertain any questions.
Thank you so much for that. That was such great information, I think, for all students on around. And I appreciate the fact that you provided, I think, a little bit of just knowledge that all schools are doing currently in regards to, you know, the contingency plans that you all have in place. I think our students, you know, have that in the back of their mind. You know, will this affect, how will this affect my potential admissions if I'm a student who is applying, you know, in the next couple of months or what have you. So thank you for that. Any questions so far, students, that you may have, please feel free to jot them down here in the chat. And I think this is the best time for you all to really engage in that. Any concerns you may have, anything that you might have been thinking about, maybe pre-COVID that, you're sort of, now sort of trying to figure out how to address that given this current climate. I think it's really important that you ask it now. Let me see if I'm seeing anything here. As those questions come up, any recommendations in terms of, what kinds of experiential learning? I know that the requirements, right, that are being asked of folks who are applying, I saw, the application, I saw the course, and things like that. But any type of experiential learning that the committees are looking for students that are applying?
That's a great question, Sandra. Thank you so much. So a couple things I often will start off in terms of helping students through thinking about experiential learning. And the first one is to try to focus your energy and attention on stuff that you really feel like you want to be doing. And I'll expound upon that a little bit more. But what I mean by that is I'll tell you first what the committee is not looking for, or any admissions committee is not looking for, are students just checking lists, right? So sometimes I think with the angst of ensuring that you cover all your bases, students may do 2 hours here, 5 hours there, 10 hours there. And I would discourage that approach. I think what I would encourage students to do is really identify, a few things or areas that you're really, really interested in. And more than sort of an extensive checklist of stuff, committees are really looking for whether you've done stuff in a sustained way. So a couple kind of top areas or areas clinical areas, for example, that I'm thinking about for many students would be working as a scribe. And mind you, a lot of what I'm saying is pre-COVID, right? I think things are changing rapidly post-COVID. So medical scribing, that's become a way for students to not just be engaged in a clinical setting. And it's seen as more than just shadowing, right? When you shadow a doctor, you're usually quite literally kind of walking around with them and watching what they do. And I think though there's significant benefit from shadowing, I think students who scribe really get completely engaged and engrossed with the terminology that's being used in clinical spaces. They really get to, at least watch the doctor, fully engage with the patient. They take, the history, in terms of what's happening in that encounter. So that's always been a great thing to do. I've also seen other, one of the more popular areas doing MA work, a medical assistant stuff. So these are all clinical kinds of things. A lot of times we get the question, do you have to do research? And my response to that is you don't have to do research. I think if research is the thing that you are really interested in, it does give you yet another lens through which to think about how to answer difficult scientific questions. So there's definitely a skill set that students will get if they conduct research, but I wouldn't do research just for the sake of doing research. Another area that admissions committees are really looking at is service. Have you done any sort of service for your community? I do know that many of you, perhaps even at Whittier, are already engaged in some of the surrounding communities. Maybe you're part of affinity groups at your school. So I would begin to think about it more in terms of the kinds of stuff or experiences that you're really interested in and go from there. Does that kind of make sense?
Yes, it does. And I'm seeing a couple of students, shaking their heads there. I appreciate that you mentioned that. Geisha, how do you want to go ahead and do this? I did see a couple questions come up.
Okay, well, I want to point out that I also put our email address in the chat, but our email address, if you have any questions after today, is excuse me, mdadmissions@kp.org. And I'm also going to send the Career Center the link to our building video so she can make sure that gets to you, as well as the curriculum. We can get that out to you as well. Looks like we have a question from, I'm so sorry if I mispronounced, but I understand. My name is Geisha. Is it Mahima? I think. Mahima, did you have a question? Go ahead and unmute yourself, Mahima.
Go ahead and do that.
And then I think the next question will be from Colini.
Mhm.
Go ahead, Mahima. You're unmuted.
Hi, I'm Mahima, and I'm a first year.
Hi,
And,
Mahima.
hi. So due to this pandemic, I haven't been able to continue shadowing and volunteering at the hospitals. And I know that's, you know, so I was wondering if this would hurt me in the admissions process, and should I make up for the lost hours after the pandemic?
What a great question, Mahima. Thank you so, so much. And no, I'll start by saying absolutely not. It will not hurt you. I don't think any of us could have predicted the significant impact that COVID-19 is having on all of our lives, right? We're kind of stagnant. Look at us. We are all in our homes. Sandra's at work. Yeah, we are at home. Exactly. We're wearing masks. I don't know that that's ending for another year and a half.
Right.
Look, these are unprecedented times, Mahima. So I think that I wouldn't even think about it in terms of making up the hours. It's hard to know, when will you ever be able to go out and shadow? So some of the things I've been encouraging students to do, and a couple students have pointed out that, you know, they've been kind of successful in this way, is seeing whether there are any online outreach opportunities. We've had students who've shared with us that they've been doing stuff online. So, you know, even doctors within Kaiser Permanente are primarily now remote, right? Unless you work in an emergency department or you're a surgeon doing trauma surgery, because even elective surgery have been canceled, not just at Kaiser, but at the institutions. So there are physicians who are doing a lot of telemedicine stuff now. So I would encourage you to see whether there are you know, opportunities to engage online. Are there organizations that are, you know, looking for help virtually? So I suspect for quite some time, all that we do will be, you know, I still think about our lives, and even for you guys as pre-med students, as pre-COVID and post-COVID. And every single person who reads your application will understand that. So I would rather you not fret too much about that part as of now.
Okay.
Does that kind of answer your question, Mahima?
Yes, it does. So if there are any opportunities with like any other doctors that or hospitals I'm affiliated with, if they are having like, you know, remote
Exactly.
Okay, so I should try to get involved.
Absolutely. I would urge you to try to connect in that way. Absolutely.
Okay, great.
But thanks for that question. Such an important one. Thank you.
Thank you.
So our next question is from Colini, and she has a question about the MCAT scores and when she took it.
Great. Absolutely.
Colini, there you are.
Yeah, my question is actually on behalf of a student. They took it back in 2017. Took a pause there now. They're in their master's program, and very interested in continuing forward. Would they need to retake their MCAT again?
Great question, Polina. Thank you so much. And the way that we've structured it, the answer would be yes. I will tell you that Agasia, Marissa, Tamara, all of our admissions officers, myself, we meet at least a couple times a week. And I think every week we meet, there is something new that has evolved as a result of COVID-19 and MCAT testing, et cetera. So what I would say to that student is please apply nonetheless with the score that you have. We will continue to monitor how things are going in terms of the testing. Right now, we need students to have taken the MCAT no earlier than 2018. So the answer would be yes, a retake would be necessary. But that said, it may very well be that that's the only score that the student may have, just depending on. So that would be my message to the student. Please apply. Preferably, yes, we need a retake. However, we're not sure yet because I do not know at what point the testing will reopen. The other thing I'll point out on our call, and I think Agasia was on that WMC call as well, where they talked about not just replacing dates, but extending the testing time as well. Mm-hmm. So they're planning on opening up even more dates. And then a couple things I always like to remind all students of. They've also told us that they will be making, I think they're waiving fees for for the MCAT. They're also going to be providing a lot of the test prep materials. Acacia, keep me honest. Either
I'm keeping you honest. You're right.
Yeah, I don't remember if
This is a great time to get in on those MCAT
Yeah,
prep.
so a lot of testing prep now available, if not at no cost, at very, very low cost. So I do think the AMC is going in the right direction. They're being extraordinarily student-centered, and if any of you are, I know, Mahima, you will not be applying for a while, but some of you may be sooner. So hop on those study materials because they are getting them ready for you. So I think they're doing right by the students. You guys had nothing to do with COVID-19, so you should not be penalized for that. So.
Looks like we have two more questions. The next one is from Jasmine, and she has a question in regards to prerequisites for sociology.
Yeah, yes.
Hi, I'm Jasmine. I'm a
Hi,
first
Jasmine.
year. So I've been talking with Dr. Badinger, our pre-med advisor at Whittier, and she was telling us that sociology 244 would be the course that most medical schools would take, but for Kaiser, would any sociology class suffice?
Great question, Jasmine. Thanks so much. And most of it, you know, the numbers, you know, it sounds like it's upper div. It sounds like the content would be, yeah. So I think that the answer to that is we're not being specific in terms of the kind of sociology that you're going to take. So I think if 244 is what is next for you, I would go ahead and do that.
The academic advisor in me is coming out, so I'm kind of wondering, what is 244 sociology? Please tell me.
Yeah, the content.
So sociology 244, the class title is Social Class and Inequality. So I guess it dives deep into like the different social classes in society.
Oh yeah, that's perfect.
Thumbs up
that's
for
perfect.
that. I think that's at least 2 thumbs up. I only have 2 thumbs. But that would be perfect because it's also so well aligned, Jasmine, with a lot of what we're going to be teaching when you come to medical school with us. So thanks for that. And thanks, Acacia, for being granular. I appreciate that.
And a question from Joshua Morales. He has a question about the, looks like applications. I think he's applying for this current cycle, next coming cycle, and about COVID-19 and the application cycle and interviews.
Go for it.
Hi.
Thank you.
My name is Joshua. Yeah, and my question was in 2 parts. The first part is asking more about what you look for in terms of interviews for applicants in terms of personality and motivations to go to medical school. So like, what specific things are you looking for in that sense?
Yeah. Great. So let me start. Thank you, Joshua, for that incredibly important question. I think a couple things that, you know, as I'm thinking about when I open up Joshua's application, what I start by doing, and you know, personal statements. Although I think depending on who you talk with, some people say, oh, you know, no one reads that. Well, I will tell you at our school, everybody reads that. Okay, so looking at your personal statement for who Joshua really is. So we're looking for students to represent their authentic selves to us. And then the other thing we're looking for is clarity in why you're pursuing medicine. Okay, so before you even begin to write your personal statement, I would encourage you to reflect, and that's kind of the pre-med advising and mentorship that I do for all pre-med students, is I first ask the question, when did you know you wanted to be a doctor? And you know, a lot of students will pause and say, oh my goodness, wow, it was gradual. Or some students will say, this is exactly when it happened and why it happened, right? So I think that answer carries a variety of reasons. But, you know, I think knowing with some level of clarity why you're choosing medicine as a career. And it has to be more than to help people, because, you know, priests help people, teachers help people, career advisors help people, all kinds of people help. What that?
Oh, you help people as well.
Yeah, so teachers help people. So there's so many professions that are so highly influential in our lives that it's nice to know, but why through medicine, right? So, you know, once you've answered those questions, building on that would be extraordinarily important. So once that's done, what then are we looking for besides clarity? Well, we are looking for students who recognize that the status quo in medicine isn't serving all people in the ways that it should, right? So we're really looking for students who are deeply passionate about making a difference. So we call that change agents, right? We're looking for change agents. We're really looking for students who want to be advocates and leaders on behalf of all communities, right? Not just some, but of all. And, you know, we're looking for students who are kind of adaptable. We're a new school, so we know that everything's not going to be perfect on day one. So having some level of maturity and adaptability is extraordinarily important for us as we are looking for different attributes and qualities in our students. And, you know, I talked a little bit about our coaching course or coaching program. Not every student likes that level of coaching and engagement. So I think knowing yourself and kind of your own ways of engaging would be important, because we do want students who value that level of coaching as well. And then we're looking for students who've done well academically. If you had 1 or 2 years that didn't go great for you, you know, please let us know why. We know that life interrupts a lot. So I think as long as you're being clear on kind of what happened in your life, if you've done great throughout, then great. Does that kind of answer some of your questions,
Yeah, that's
Joshua?
a very good response.
Great, great.
Yeah, and then my second, I had another part to that question.
Okay, sure.
Also interviews, but I mean, you know, in this COVID-19 situation,
yes,
you know what's going on with the MCAT.
Yeah.
And if the MCAT happens to get pushed back further than October,
Yeah,
I was wondering, will you give out interviews to students before they have the chance to take the MCAT?
Yeah. I don't think we're going to have a choice. I think the answer is yes, right? So we are truly, truly trying to remain flexible and calm, and encouraging you to remain flexible and calm. And yeah, we're not going to have much of a choice. If, you know, MCATs don't resume till January or February of 2021, you know, it's not going to work that way. So we have no doubt that if that is the case, we will have no choice but to end up interviewing students who have no MCATs, right? And we will then have to look more heavily at other aspects of the application. And that brings me to a point that I didn't really talk about because it wasn't necessarily an admissions presentation, but we do already, Joshua, utilize a holistic approach. So though we have to look at MCAT, we have to look at GPA, because, you know, we have to make certain that you are ready to do the med school work. We look at so many other things, right? We look at your distance traveled, we looked at your many lived experiences, we look at mishaps you may have had in your life and overcome, so resilience. So there's so much that we look at. And the other thing that we promised ourselves we would do in the first cycle, and we did it, and we're doing it again this upcoming 2021 cycle, is we do read every single application that is brought to us. So we're not a school that throws you know, applications based on, you know, academic metrics into the computer and we have it sorted for us. The only thing that sorts our computers are our eyes. So we do, in fact, read every single application. So although the MCAT, we want them, I'm not certain that it changes a whole lot of how we look at applications anyway. So.
Okay, thank you so much for the answering
Absolutely. Absolutely, Joshua. Thanks for that question.
Looks like we have one more question. Please keep me honest on your name. But it's kind of similar situation. How will we basically evaluate students with prior MCATs versus students who don't have MCATs?
Right. Great question. And who is asking me?
Is it Agni?
Agnieszka.
Oh, Agnieszka.
Oh, you're muted.
Hi, Agnieszka.
There you are.
Hi, Agnieszka. How are you?
I'm good. How are you?
I'm good. Thank you.
Yeah, so my question kind of is, I know there's students who, for example, I took the MCAT last summer because I was planning on my last cycle and I ended up not doing so. And I was planning on retaking the MCAT in April and then in May, and then none of that happened. So I'm figuring that I'm probably going to have to apply with the MCAT I had last summer.
Yes.
So I was wondering, like, how are you going to compare those students who have the MCATs to don't? Because I don't want to be, like, tossed out because my MCAT's not as high as I want it to be, compared to someone who might not have it but have a similar GPA to mine.
I so appreciate that question, Agnieszka. And we would have to be fair to the process. And what that means is that if students are unable to take that exam, we as a school are going to have to make a decision as to whether MCAT is part of the metrics we look at, but we can't look at MCAT for half of the people or a quarter of the people and not for 75% or so. We would have to level the playing field and do some re-level setting and say, well, this cycle, we're not using MCAT. Does that kind of make sense? Because otherwise it wouldn't be fair, right? Because you didn't have the opportunity. If you're trying to take it to get a different score, we can't fault you for not being able to have the opportunity to do that, right? So we would have to simply say, well, we are filtering out the MCAT piece on people's applications for review, something like that. Does that kind of make sense?
So applying like early in the cycle with what I have isn't necessarily going to work against me.
Absolutely. And that's, you know, I know we're probably coming close to being out of time. And the thing I would like to leave you all with is that we absolutely want you applying earlier than later for those who are applying this upcoming cycle. Please, please, please do your applications early. The cycle is going to open up on May 4th for you to start entering your info. I think uploads begin on May 28th. And the WMC is still, you know, debating whether we as a school will get files on June 26th or later. But start your application sooner than later. Start getting your letters done. You guys know the drill. So do that earlier than later. Yeah.
Thank you.
Absolutely. Thanks, Signature, for that question.
Dr. Willies-Jacobo, do you have time for one more question?
I do. I do.
Okay.
I do.
Okay there. So
I have asthma.
Goodness. Okay. So I want to go ahead and ask the question. I know that we have, you know, some students that may be DACA recipients, and so I'm wondering, you know, for those students that are passionate about this work and want to go ahead and pursue this career path, any recommendations, anything different that they need to be considering, things of that nature? If you can
great question. And I'll start by saying that DACA recipients, we want you applying to our school. We had many DACA students who applied to our school and a few who were also admitted to our school. So we are cognizant that you don't lack passion and you bring much of that to us. So nothing different from our perspective. I do believe, and I'll have to look into which amongst schools, but more and more schools, I think, are putting aside funds to ensure that their DACA students are covered. I will say for us as a private institution, we have the funds for any DACA student who applies to us for the entirety of your career with us. So I do want to encourage you to apply to our school and, you know, express your passion in your applications and don't get distracted by some of the noise. You know, keep focused. So that's my advice to DACA recipients. Yeah.
Awesome.
We also have other scholarships and housing stipends available for our admitted students as well. So you would be welcome.
Absolutely.
What you're saying is apply.
Apply.
Yes, apply.
Do it. Absolutely. Apply. Absolutely.
Wonderful. I don't see any other questions, and I know that we are at time. So I really want to say thank you so much, both of you, for your time today, for your wisdom. I'm super excited. I'm like, if I was in this, you know, route, where do I put my name down?
Yep.
You know, these are very challenging times, and I think a lot of our students have done amazing work outside of here. They're very, you know, social advocates. They're social justice oriented, and are constantly, you know, getting involved. And so I know that right now it feels like, you know, I can't do much, right? That I can't do much, but there's so much that you can do virtually, right? So are students able to connect with either of you if they have any questions, if, you know?
Absolutely. Please share. I know Agasia, Marissa will be hot on checking our empty admissions box, but I want to open up my email as well, Sandra. So please share. I think you have it. So please feel free to share with the students. I'm glad to engage in another one-on-one chat with anyone who would like to. I can talk by phone, any way people would like to. I would like us to be accessible to our Whittier students, absolutely.
Definitely, we definitely will.
Okay.
Yeah, Ageisha putting down the admissions email, right? And I will definitely send the email out.
Wonderful.
To students. So, you know, with that, thank you again so much, both of you, for your time. Students, if you have any other questions, please feel free to reach out to the Career Center, reach out to Genevieve and Elizabeth, who are, you know, our ASAP amazing advisors as well. And additionally, tomorrow we will have another virtual session. It's a brief session on virtual interviewing and networking. So
beautiful.
You know, as was mentioned today, this is one of the things that you do have access to, right? So how do you do that successfully? And I think this is the best time for you to start reaching out to folks that may be in a profession that you're interested in, and maybe doing some of those informational interviews, right? And asking what is it that they do, how are they, you know, what do they like, what do they not like? But just increasing your social capital. I think a lot of our students, primarily our students of color, tend to not have that, right? So this is the time to engage with conversations, build that network, and reach out to folks from home. You can do that. So thank you again, both of you, so much. Thank you, students.
Great.
Today. We really appreciate it. We'll make sure that we have.
Thank you. Thank you, Sandra. Thanks all. You guys were amazing. Thank you.